Yes, good afternoon everyone. Good afternoon, sir. Now I will perform the infant bath and feeding, and also I will demonstrate on how it is properly done. Now we'll start with the waivers. So the waivers is starting with the washing of the hands. So washing of the hands is very important because it will prevent the cross-contamination between the patient and the caregiver. So we also always remember the 5 moments of hand washing, which is the before touching the patient, before aseptic technique, after body fluid exposure risk, after touching the patient, and after touching the patient's surrounding. So the equipment, I should ready all the equipment before coming to the room or to the ward to minimize delay of the procedure. So that is also and to avoid the of course to fasten the procedure. So my equipments now are the 2 basin for sterilizing, for washing the feeding bottles. I have here the swaddle blanket, the bath blanket, and also the bib, towel, small towel, head cup, and the dress for the infant, diaper, also the brush when cleaning the feeding bottles, the comb, also the feeding bottle sterilizer, the bathtub, yes, a shampoo, and weighing scale, the thermometer. So that are all the paraphernalia or the equipment. Next is I will announce my presence to the patient. So I will start by knocking on the door and coming inside to the room. So I will introduce myself to the patient, or to the patients, or to the baby, or to the infant parents. So good morning, ma'am. Good morning, sir. Or good afternoon, sir. Good morning. Good afternoon, ma'am. I am Noelle Descallar. I am your caregiver for today, and I will attend to your baby. So I will perform several procedures this afternoon. After that, you will verify the baby and verify the patient, the parents of the infant. So, ma'am, may I know what's the name of your baby? Okay, the name of your baby is Angela. Okay, ma'am, so your baby is Angela. She is a female infant. Okay, ma'am, may I know your name, or also if you could ask the name of the parents, you ask if possible. So now, after verification, I have to explain to the parents of the infant the procedure. So I will explain what are the several procedures that I will do this afternoon. So that would be the changing of clothes, the bathing of the infant, the washing of the head and the face, and of course, cleaning of the bottles, feeding the infant. So this explaining the procedures is very important because it will give the parents the idea of what should you do to the infant. And next are the respect. So we have to close the door, the parties, in starting the procedure. And the safety, of course, we have to turn off the AC. That is to prevent from the infant to for hypothermia or being exposed to cold conditions. So we have to turn off the AC, especially during the bathing of the infant. And of course, we have to check also the table, maybe stable or not, and check the table if there are any hazardous material that would harm the infant. So now I will proceed to the first procedure. So now I will take the baby from the crib. So before taking the baby from the crib, so I will ask the parents if I could take the baby from the crib or the infant from the crib. So ma'am, I can take Angela from the crib. So if the parents would say yes, then you can proceed to the next procedure. So you can take the infant to the table. And now, since the baby, so we'll put on the diaper or the nappy. So in the proper way of putting on the nappy is we have to hold the two legs of the infant and insert this one. So the size of the nappy actually depends on how old is the infant. So if the infant is 1 to 7 months or 1 to 6 months, so should be given the appropriate size. Okay, now I'll demonstrate to you the two ways of putting the swaddle blanket. First is without the cap or without the head cover and with the head cover. So first, this is the swaddle blanket. Swaddle blanket, I have to lift the baby, holding the baby in football hold. So now, so we have to make a fold the end of the cloth. And the fold should be in the shoulder level of the infant. And next is we have to fold this one overlapping the body of the infant. You can do two ways. You can insert it under the arm, or you can insert including the arm into the bag. And then fold the lower. And wrap it. Okay, not too tight, not too loose. This is to prevent suffocation of the baby or the infant, and also thermoregulation. So if it's too tight, the child will have a increase in body heat. So it's possible not too tight, not too loose. So this is the first way of putting a swaddle. So in lifting the baby, you should use your two hands like that, and then support the neck and the head and the football hold. So that is the proper way. You should always support the head of the baby or the infant because it is still very sensitive and it could not hold its own weight. So you should support the under the head, on the neck. So next, I will demonstrate to you the proper way of putting a swaddle with a cover on the head. So just the same, but you should cover the head like this, making sure it is inserted on the left and right under the ear, and then fold. Same way as the other candle procedure, insert under the arm or include arm, and then the lower one, and wrap the infant. So this is it. And take the infant. Same procedure like that. Okay. Next is I will demonstrate to you how to wash the head of how to clean the face of the infant. So in cleaning first the infant, I have to check first the temperature of the infant. So it is very vital to check the temperature of the infant because we should know that the infant should be in normal condition before applying any like water. So because this might cause the infant to be ill or sick. So we have to check first the temperature of the infant. Don't panic. So if the normal temperature is, if the temperature below falls to 35.5 to 37 degrees Celsius, then the temperature is normal. So above and below to that range, it is abnormal, so or not normal. So you cannot proceed to the next procedure. So report immediately to your nurse, to the assigned nurse. So okay, let's assume that the baby has a normal temperature. Okay, I'll proceed to the cleaning of the face of the baby. So let's proceed. Let's start from the upper part of the face to the lower. So now I will apply. I will use gloves since that won't touch the baby. So you should always remember to put on the gloves because we might bring any infectious disease that it can be harmful to the infant, or maybe the infant have some infection that might be harmful to the caregiver or to the health provider. So now let's start. Let's proceed to the using a cotton ball with a little moist with the water. So in cleaning the face, we should first clean the eyes from the inside part to the outside. So doing like that, it should be like this. Okay? So you can repeat as long as you want until the eyes are clean. And then, next is cleaning the forehead. So clean the forehead, it should be like this until the tympanic area. So here. And then you can proceed also, you can clean many times. You can use unlimited to the cotton balls. And from the tympanic to the cheek in C motion. And then from the nose to the chin. Okay, and then proceed to the neck. So in cleaning the neck, from the middle part, maybe in the tracheal part of the neck to the outside, two sides. So that. Okay, we're now ready. We're now finished with the cleaning of the face of the infant. And now let's proceed. Before we proceed to the washing of the head of the infant. So we will not take this clothes or the swaddle. We will not take this swaddle because it would prevent. It would help it would prevent from thermoregulation or it prevent from being hypothermia. So also we have to clean the ears from inside of the ears to the outside of the ears and the back. Okay, so now we're ready. And then, let's proceed to the washing of the head. So in washing of the head, we have to lift the infant. Okay, hold it up, hold. And you can use your hand and mixing a shampoo with water, or you can use a small towel, wet with water, and then put the shampoo, make it soapy, and apply it to the head of the infant. So now I will demonstrate and using a cloth or using a small towel, apply a shampoo, apply a shampoo, and then make it soapy, and then apply to the forehead. Okay. We have to be careful in applying the shampoo to the head of the infant because it is still sensitive. And there is a hollow part here in the middle, which is the fontanelles. And we have to apply evenly the shampoo. And then we can wash. Rinse this one. And then put it back here. And top. Okay, to dry. To dry the head of the infant. And next, we'll proceed to the changing of the diaper. So we have to check if the diaper is full of urine or the baby had poop earlier, since that washing the infant or applying water that is different temperature from the body would inhibit or would stimulate the infant to urinate or to poop. So now the baby has, let's assume that it has a poop. So we have to roll this a little under near the bottom. Okay, so we have to clean the infant. So in cleaning the infant, so we have to use this motion. Near the good one. Okay. And 2. Okay. So we can repeat the procedure until this area, the genital area, is clean. But we have always to remember that we should avoid touching the infant sensitive part of the genitalia and the clitoris that might cause the sexual pleasure in the future of the child. So we have to avoid that part. So now we're already done with the cleaning of the infant. So we have to keep this one, the garbage. Since I have touched already the diaper with feces and urine, so my gloves are already soiled, so I have to change this one. So assuming that I changed my gloves, okay? Assuming that I changed my gloves, I have a new gloves now. So now I will proceed to the measurement, weighing, and taking the circumference of the head of the infant. So in taking the circumference of the infant, we have to use in centimeters, okay, measuring in the largest circumference of the head. So the circumference of the infant is 31 centimeters. And measuring the body of the height of the infant, so there are two ways. So we can do just like this, on the side. Okay. So 46 cm, or doing the back. Now, let's proceed to weighing of the infant. So now with the infant baby weigh 3 kilograms. And now let's proceed to the bathing of the infant. So we already checked the temperature of the infant before, so the temperature is normal. So we can proceed to the bathing. So now, first, I will hold the infant. I will prepare this one first. The towel blanket. Or the bath blanket. Okay. So now it is ready. And doing the infant bath, so I have to put this part of my arm to the tub, and then with the tilted position, or maybe a slanting position. So the head must be up, or upper, or and then the body is lower, and it touches the water. So I stop. And now I can use two ways, the hands, including the soap, or applying the soap, or the clothes. So now apply the soap, and then we have to rinse. Okay. We're done in the bathing, so we'll put the infant and the towel bucket. We have to tap. Just tap, don't rub, because it might cause rashes or skin irritation to the infant. Just tap. Okay. And now let's put on the diaper. Let's put the new diaper for the infant. starch to be folded because it might cause irritation to the body of the infant. So, just like that. And then, apply the dress. So we have to do it quickly because we don't need, we should not avoid the infant to be exposed to the surrounding. We expose the surrounding temperature because it's different temperature, and the infant might get cold or sick. So quickly but precise. So okay, Angela, so you know you feel good. Then I will give you a very good bath. And then we have to take the swaddle. Prepare the swaddle blanket. So I'll be using without head cover because I will use the head cover. Okay. We are already finished, Angela. And okay, let's put the head cover. So now the baby is ready. So the mom can take the baby. You can ask the parents if they want to hold or to carry the infant, or will bring back the infant to the crib. So now let's take it. Let's take the baby. Okay, mom, you want to carry the baby, or you want me to put the infant or Angela to the crib? So if the parents want to relax and put the infant to the crib, so I can put it back. You know, I'm done with the infant care. Now I'll proceed to the preparing the formula for the milk formula and washing the bottle. So I will change my gloves since it's already soiled. So I will wear another gloves. So I will do a hand rub first. Hand rub. And wear a new gloves. So always remember we should have an aseptic procedure to avoid contamination, since the body of the baby or the infant is very sensitive, so we have to avoid contamination. So I have the basin here. So I will take so since it's already prepared, sterilize nipple cover and bottle, so I will take the essential material for preparing the milk formula of the infant. So I will take the nipple holder, the cover, and the bottle, the infant bottle, the infant feeding bottle. So the basin that I used before is not the same with the basin that I use now. Okay, so I'm just not assuming. So now this is the nipple holder. So I have to push the nipple, rubber nipple, to the nipple holder. So I hope it's the same size. So I will prepare the milk. So in preparing the milk of the or formula of the infant, we should always check the expiration date of the milk. So you can see the expiration date at the bottom of the can or on the top of the can. So and checking the expiration date is very important. This is to avoid food poisoning. Especially in the infant that they are very sensitive, their stomach is very sensitive or their digestive system is very sensitive. And or we have also to take the formulation. So here it says that 3 scoops per 90 ml of water. So now, if 3 scoops per 90 ml of water, so we have assuming that I will put a water here, 90 ml water. Okay, so now I will take the milk. So in scooping, just like that, don't press the milk with a scoop. So